Everyone, I'm Alexander Kuklin with Personalized Medicine TV. Thank you for joining us today. This is a live show. Our next guest is Dr. Richard Zhao. Dr. Richard Zhao is currently a professor of pathology, microbiology, immunology, and human virology at the School of Medicine, University of Maryland, Baltimore. Hello, Dr. Zhao.
Hello, Alexander.
I just want to add that Dr. Zhao is also the division head of molecular pathology in the Department of Pathology, director of Translational Genomics Laboratory in medical school, and director of Molecular Diagnostics Laboratory at the University of Maryland Medical Center. Dr. Zhao's clinical expertise is in the area of molecular diagnostics and personalized medicine. His basic science research interests are in HIV, AIDS, cancer biology, and nanoparticle-based single molecular detections. Dr. Zhao has published over 100 scientific papers and has served on more than 10 scientific editorial boards. He has been invited to give lectures in more than 20 countries worldwide, and we are honored to have him on our show. Is there anything else you would like to add, Dr. Zhao?
That's a great introduction. Thank you. It's a pleasure to be here on the Personalized Medicine TV.
So, today's talk, we invited you to actually discuss individualized molecular testing for personalized medicine. Can you tell us your interest in personalized medicine and how do you define it, and what can you tell us about individualized molecular testing?
Well, my interest in personalized medicine in a way is because of a couple reasons. One is at the University of Maryland, as you mentioned in your introduction, I'm running a molecular diagnostic laboratory. Basically, we use molecular biology-based testing for disease diagnosis. And the second one is because the sequence of the entire human genome. Now we learn more and more about each individual variation to drug therapy and among other things. So that sort of came up with this new terminology called personalized medicine. So at the University of Maryland, I have actually started talk about this since about 6 years ago. So every year I organize a symposium on campus to discuss a related subject.
And how would you define individualized molecular testing? This is the topic for today.
Well, yes, basically a molecular, individualized molecular testing is a molecular-based testing, diagnostic test, for diagnostics, treatment, prognosis of a particular, for a particular individual, and to treat a disease or a condition. So that's what we talk about personalized medicine. Before we can treat a patient or care a patient, we need to know what is the genetic background of that particular information, person, and then we can use that genetic information to treat the patient, for example, to select the right drug, to adjust the correct dosing of the drug, and also to predict the outcome of particular treatment. In fact, what I just said, that three criteria is also the definition of personalized medicine. At least that's my definition.
Usually we discuss personalized medicine here on this show, and many people log in and they wonder what is wrong with the current medicine. Is there a problem there? Because suddenly the fashion is personalized medicine, and it covers a lot of things.
Yeah, well, I won't say current medicine is wrong. It's basically whatever we do is limited by the knowledge we have. And prior to the genetic era, or prior to we know the human genome information, the individual variation, and what we do is one is we focus on disease rather than focus on individual. To the clinic, and if this person have a cold, or you might suspect that there's an influenza infection, and if a person coming with a headache, and as a doctor you might prescribe a pain reliever. So that's you focus on a disease once again rather than an individual. So in terms of the treatment, that's what we talk about current medicine. That's the common practice right now is if you treat a patient you really don't think who the person is. It doesn't matter the person is Larry or Henry or Mary. Essentially, you just treat based on the person's body weight, whether the patient is adult versus a child. And one example, let's say you're just still using a headache as example. If you have two patients come in, let's say Larry is 300 pounds, Henry is 150 pounds. And you might just prescribe Tylenol or Advil, and but Larry, you have a 300 pound, you might say take 2 pills, and Henry, you can only take 1 pill. So that's the current medicine. And of course now, we talk about what's the limitation here. So as the consequence of current practice, and because that's basically the population-based treatment. And so we don't distinguish one person from another. As a result, now, because the genetic information are sort of revealing, there are many individual variability to a particular drug or a particular treatment. And so that have a certain consequences. Let me give you some statistics. For example, the drug side effect. That's actually a major problem, I believe, in the current medicine. And adverse drug side effect actually, believe it or not, is the 4th leading cause of death. And in fact, one in the world, if you talk about about 1/3 of the patient or people who died, actually is because of this adverse drug side effect. If you look at an ER visit, about 10% of the patient probably died because the side effects. So I quoted here all this statistics is not I generate the information. It's all in the literature. And so once again, this is a limitation. Let's give you another example. If you talk about now, of course, since this is a short show, I'm trying to simplify the situation. And I'm talking about overall simplified situation in general. If you talk about a particular drug, in general, once again, it's a very simplified situation. And we are talking about only about 1/3 of the patient going to be benefited from a particular drug therapy. And now we know another 2/3. They either have no effect or you have actually adverse side effect. And as mentioned, some of those side effects could lead to quite a dramatic consequences, even leading to death. And in the United States, for example, there are about 2.2 million people are experiencing the drug side effect every year. And among that, about 100,000 people died because of this. So that's where we talk about the limitation of current medicine.
Now, when you talk about individualized molecular testing, what kind of tests do you have in mind?
Well, I have to say, since we just talked about current medicine now, so we're leading to the personalized medicine. I guess we need to give our audience here a little contrast.
Yeah.
And so why personalized medicine is so different? As I mentioned at the very beginning, now because the technology are so advanced, we are able to sequence the entire human genome in a very short period of time. And so as a result, now we are able to looking at, to a certain extent, some people's, individual variability. And so now we know, for example, each one of us, we have about 3 billion base pair of a nucleotide and in our entire genome. And 99% of those information are identical among all ourselves. So in a way, we are, as a human being, it doesn't matter what your color, your race, we are essentially identical. However, there are about 3 million variation, and now we called either called as SNPs, single nucleotide polymorphism, insertion, deletion, all those genetic variabilities. And now the more we learn, the more we study, now we know those are small, very, very small percent of variability of each individual that actually determine who we are as a unique individual.